Hi everyone, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So in today's video, I'm going to talk to you about the use of statin drugs to protect the hearts in women undergoing chemotherapy for breast cancer. And as I'm sure you can imagine, as a heart surgeon, I get asked almost on a daily basis if I take a statin personally to lower the risk of a heart attack or stroke because it lowers your cholesterol. So I want to make it perfectly clear. I do, because I'm not going to die from the disease that I treat, okay? So what are statins? Simply put, statins are medications that lower cholesterol, and they reduce the risk of cardiovascular events up to 30-40%. And cardiovascular events include heart attacks and strokes and aneurysms and peripheral vascular disease. But recent research has suggested that these drugs may also play a role in protecting the hearts of women who get chemotherapy for breast cancer. And these potential cardioprotective effects have generated considerable interest within the medical community, particularly the oncology community, because we already know in the heart world that it improves cardiovascular health in these patients by, as I said, reducing the incidence of cardiovascular events. Because chemotherapy, while effective in treating cancer, has been linked to an increased risk of cardiovascular complications like cardiomyopathy, heart failure, and abnormal heart rhythms known as arrhythmias. And these cardiovascular side effects have been shown to be more pronounced in women receiving certain types of chemotherapy for breast cancer, particularly anthracyclines, which include doxorubicin, also known as adriamycin, and trastuzumab, also known as Herceptin. Given the prevalence of cardiovascular disease in women, particularly those with breast cancer, we've been eager to explore potential strategies to mitigate the cardiac risk. So one strategy involves the use of statins, which, as I said, are primarily used to lower cholesterol and reduce the risk of cardiovascular events. However, statins, in addition to their lipid-lowering properties, possess several what are called pleiotropic effects, if you will, which include anti-inflammatory effects, antioxidant properties, and they contribute to their potential cardioprotective effects. Statins have also been shown to improve endothelial function and promote the stabilization of cholesterol-laden plaques in the artery walls. And when plaques break, that leads to an acute heart attack. So all of these properties may be beneficial in the setting of chemotherapy-induced heart toxicity, also known as cardiotoxicity. Several studies have provided evidence to support the potential cardioprotective effects of statins in women who undergo chemotherapy. A retrospective cohort study by Cici et al. In 2017 found that statin use reduced the risk of cardiotoxicity in women receiving anthracycline-based chemo for breast cancer. Another meta-analysis by Kalam et al. In 2018 demonstrate that statin therapy was associated with a lower incidence of trastuzumab-induced cardiotoxicity in breast cancer patients. So these findings suggest that statins may indeed have a protective effect on the hearts of women during chemotherapy. Okay? Then in 2021, an article was published in the Journal of the American Heart Association and noted that women who take statins, which, as I said, primarily is used to lower cholesterol during chemotherapy, who get anthracyclines for early-stage breast cancer, are half as likely, so 50% less likely to require emergency department visits or hospitalization for heart failure in 5 years or in the first 5 years after chemotherapy. So researchers are saying now that statin use should be encouraged in women starting potentially heart toxic treatments for early stage breast cancer if they already have indications to take them for heart disease prevention, which basically we all do, okay? So with that, I hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or consultation, you can go to my website at www.paladinmds.com and have a great day.